It's the 24th of June and I'm doing an update for my YouTube for oromandibular, upper cervical, lingual dystonia. Mine, when I first started noticing pain, but what triggered it for me was a tongue tremor after a trip to the hospital for suicide migraine. I had such a bad migraine, I ended up in hospital for a few nights. Anyway, the update is that my injections are on the 12th of July and my last lot was the 19th of April, and I've got about 5 ulcers. When I went to eat my dinner the other night, I took a big chunk out of the side of my cheek, so that's ulcerated, but hard to show. I'm only supposed to have medication twice a day, but I kind of need it for 3 meals, and that's not being allowed, and that's difficult because then the spasms are going to start again. They're going to start again, and then it goes down, once the injections kick in a little, but overall it's still not helping much anymore. It's probably helps with the spasming and the that kind of clenching that comes from the basal ganglia and the cerebellum in my brain. It makes involuntary movements. It's a movement disorder. Like I have a chance of 30 to 40% of developing Parkinson's disease, which I hope doesn't happen because my essential tremor is starting to get worse. So trying to think of what's important before that's important. The contractions are starting to get closer and closer together. It sort of reminds me of when I was having babies, they can spread out and I'm having them every hour, but then as it gets closer to my neurology appointment, they get closer and closer, and if I talk it will exacerbate it a lot. So that's why doing a job like I used to counsel and do psychotherapy, but it would be hard having faces like that in front of your clients. So I'm pretty much unable to work when you add my back disability, my POTS, my Ehlers-Danlos syndrome, which pops muscles, and my foot was gone for a while there. Chronic migraine yesterday, which has passed a bit, but I'm still feeling quite a bit of tension through here and a lot of pain. When I put the ulcer gel on that, it was starting to bleed before. But we'll just keep going, and just really hope the NDIS can approve it soon, because in my opinion, it's really not fair. I've got a lot of conditions that require some support with things that are hard, like shopping. I can't shop, I can't work, I can't eat properly without choking. I need medication just to eat. I get a lot of nausea. Different medications for mainly to stop this too, and to help the head pain, which is quite severe in a calendar month. That was a bit all over the place, but that's probably my ADHD that I've just found out I have that too, with dyslexia and dysphagia. But I was given an over-injection, so I did a video before after I'd put the gel on, and I noticed that tremor that had been in my tongue right at the back at the start of my videos on this channel started at tongue tremor again, from an over-injection I had up here in the platysma. Look after yourselves, guys. I'm fatigued. I've got chronic fatigue. What else? What don't I have? And stay positive and peaceful, and I don't know if it's going to shorten my life, and I really hope that Parkinson's doesn't happen, but the day-to-day pain can be excruciating. But being around the kids today made it a lot easier, and they really help brighten my day and make me laugh a lot too. So, and my good friends. So take care. And if you've got any questions and you've got dystonia or EDS or POTS or any of these, just sing out and I'll try and help if I can. Okay, bye. See, that's how crooked my smile is now. And I feel it's starting to make my teeth crooked, so I'm going to have to talk to a dentist about that pretty soon. Okay, I'm going to stop smiling. It might help the spasms and read a bit. Night.